How crucial do you think it is to manage high-impact risks in aged care? A question that underscores the importance of this conversation. With age, our loved ones may face an array of health challenges, from dementia and medication mishaps to hydration concerns and the ever-present risk of falls. The landscape of aged care is fraught with high-impact risks. If not properly managed, these risks can significantly compromise the quality of life. Let's dive into these high-impact risks and explore how we can manage them effectively. First off, we have dementia and the use of psychotropic medications. Dementia, a progressive brain disorder, poses significant challenges in aged care. It affects memory, thinking, behavior, and the ability to perform everyday tasks. To manage these symptoms, healthcare professionals often turn to psychotropic medications. These drugs work on the mind, emotion, and behavior, providing some relief for those grappling with dementia. However, the use of these medications is not without risks. Side effects can range from drowsiness and confusion to more severe issues like falls or even worsening dementia symptoms. Moreover, the long-term use of these drugs can lead to dependency and other health complications. That's why it's essential to approach the use of psychotropic drugs in dementia care with caution. Regular monitoring, personalized treatment plans, and a focus on non-pharmacological interventions where possible are key. These steps can help mitigate risks and maximize the quality of life for those living with dementia. Proper management of psychotropic medications is crucial in ensuring the safety and well-being of individuals with dementia. Next on our list is hydration and nutrition. As we age, our body's ability to regulate fluid balance can decline, and appetite may decrease, making proper hydration and nutrition paramount in aged care. Dehydration can lead to severe complications, like urinary tract infections, kidney stones, and even falls due to dizziness. On the other hand, malnutrition can lead to muscle weakness, fatigue, and decreased immunity. Strategies for managing this risk include offering fluids regularly, not only during mealtimes, but throughout the day. For nutrition, serving nutrient-dense meals that cater to seniors' palate and dietary needs can encourage them to consume sufficient and balanced meals. Also, monitoring weight and fluid intake can provide valuable insights into a person's hydration and nutritional status. Healthcare professionals should also be vigilant for signs of dehydration or malnutrition, such as dry mouth, confusion, rapid weight loss, or persistent fatigue. Remember, proper hydration and nutrition play a fundamental role in maintaining health and well-being in aged care. Moving on, we have the risk of choking. For older adults, especially those in aged care, choking is a high-impact risk due to factors such as weakened muscle control, difficulty swallowing, certain medical conditions, and even some medications. It's a serious concern that requires careful attention. The good news is, there are strategies to help manage this risk. Providing soft, easy-to-swallow foods can be beneficial. Staying vigilant during mealtimes and encouraging slow, mindful eating can also make a significant difference. It's also crucial to ensure that dentures fit properly and are in good condition, as ill-fitting dentures can increase the risk of choking. Training staff to recognize the signs of choking and respond swiftly is equally important. Regular drills can ensure that everyone knows what to do in an emergency. Remember, in aged care, it's all about promoting safety, comfort, and dignity. Prevention and early intervention are key in managing choking risks. Now, let's talk about medication administration. In aged care, it's crucial to get this right. A single error in dosage or timing can lead to adverse effects, and in some cases, serious health issues. It's not just about giving the right pill at the right time, it's also about understanding the interactions, side effects, and monitoring for effectiveness. One strategy to manage this risk is employing a medication management system. This can help ensure the correct medication is given at the correct time, in the correct dosage, and to the correct person. Regular training and competency assessments for staff can also be beneficial. Another strategy is involving the individual and their family in understanding the medication regimen. This fosters a sense of ownership and can lead to improved adherence to the medication schedule. Remember, it's not only about administering medication, but also about ensuring the medication is working to improve the person's health and quality of life. Proper medication administration can prevent adverse effects and improve health outcomes. Aside from the risks we've already discussed, there are several others that are worth mentioning. Let's take a moment to talk about pain. Pain is not a normal part of aging, but it is common in older adults. Inadequate pain management can lead to decreased mobility, increased risk of falls, and a decreased quality of life. But pain can be managed effectively. It starts with regular assessments, using validated tools designed for older adults. Non-drug interventions like physical therapy and mindfulness techniques can also play a crucial role. And when necessary, medication can be used judiciously, always balancing the need for pain control against the risk of side effects. Next, we have pressure injuries, also known as bed sores. These are injuries to the skin and underlying tissue resulting from prolonged pressure on the skin. They're most common in people who are bedridden or use a wheelchair. Regular repositioning, good nutrition, and maintaining skin integrity are all key to prevention. And if a pressure injury does occur, prompt treatment can minimize damage and speed healing. The use of restrictive practices is another high-impact risk. These are measures used to control a person's behavior, and they can include physical restraints or medication used for the purpose of restraint. While sometimes necessary for safety, they can also lead to injury, distress, and loss of dignity. The goal is always to use the least restrictive measures possible and only as a last resort. In many cases, changes to the environment or the use of non-pharmacological interventions can reduce the need for restrictive practices. Delirium is an acute, usually reversible state of confusion. It can be triggered by a variety of factors, including infection, medication, or a change in environment. It's important to recognize delirium quickly, as it can be a sign of a serious underlying condition. Management strategies include treating the underlying cause, ensuring a calm and familiar environment, and providing reassurance and support. Hearing loss is common in older adults and can have a major impact on quality of life. It can lead to social isolation, depression, and even cognitive decline. Regular hearing checks, the use of hearing aids, and strategies to improve communication can all help to mitigate these risks. Finally, let's talk about falls. They're a leading cause of injury in older adults, and the risk increases with age, but falls are not inevitable. Regular exercise to improve strength and balance, ensuring a safe environment, and regular review of medication can all help to reduce the risk. Each of these risks requires specific management strategies to ensure the safety and well-being of those in aged care. As we've seen, managing high-impact risks in aged care is a complex and crucial task. Let's take a moment to recap what we've covered. We began with dementia and the use of psychotropic medications, highlighting the necessity of careful monitoring to prevent adverse reactions or over-medication. We touched on the importance of hydration and nutrition, noting that meticulous observation is key to ensuring that these basic needs are met. We then addressed the risks of choking, emphasizing the need for careful meal preparation and supervision. Medication administration was our next topic, a process that requires precision and adherence to strict guidelines to prevent errors. We also discussed pain, a pervasive issue for many aged individuals. Timely and appropriate management of pain not only improves quality of life but also prevents further health complications. Pressure injuries, unfortunately common in aged care, require proactive prevention and early detection. We stressed the importance of regular repositioning and skin checks. We then delved into the use of restrictive practices, a controversial topic. It's imperative to use these as a last resort, always prioritizing the dignity and autonomy of the individual. Next, we highlighted delirium, an often overlooked condition that can have serious implications if not promptly detected and managed. Hearing loss, another common issue, can significantly impact a person's quality of life. Hence, regular hearing checks and provision of aids can make a world of difference. Finally, we discussed the risk of falls, a major concern for the elderly. Through risk assessments and modifications to the living environment, we can significantly reduce the likelihood of falls. In all these areas, proactive risk management is not just beneficial, it's essential. It's about more than just preventing negative outcomes. It's about providing an environment where those in our care can thrive, not just survive. Remember, the goal is to ensure the best possible quality of life for those in our care. Thank you for joining us and stay tuned for more health-related insights. Before we conclude, we want to thank you for taking the time to watch our video on managing high-impact risks in aged care. We hope you found it informative and useful. If you did, and you want more insights like these, don't hesitate to subscribe to our channel. By subscribing, you'll be kept up to date with our latest videos, allowing you to stay informed about crucial topics in aged care. Remember, knowledge is power. The more we know about aged care, the better we can provide for those in our care. So don't forget to hit the subscribe button for more videos like this. Stay informed, stay safe, and thank you for joining us on this journey towards providing the best possible care for our elderly. See you in the next video.